So how does stress affect the skin? How does stress affect the repair?
Well, stress is a trigger for whatever you're prone to. So if you're prone to eczema, psoriasis, breakouts, ulcers, hair loss, any of those things, stress is going to drive that. And it's a bunch of pathways we understand and some we don't, but it's mostly cortisol driven. And then also you have to figure when people are stressed, they have a more poor diet and they eat more highly processed foods, high sugar, simple sugars, so that's pro-inflammatory. And all of that drives aging in the skin. That imbalance of cortisol, that inflammation affects the skin. And the beauty of it is that when you treat the body better, your skin looks better. So when I see the skin, I can often tell if somebody is stressed, if they're depressed, if they have heart disease, lung disease, liver disease, a whole bunch of things you can see just by looking at the skin and certain skin findings between the tone, the turgor, the quality of the skin, even someone's posture if they're making eye contact. All of those are visual clues that we have as dermatologists from looking at our patients over decades. And so I put a lot of that into my book called Beyond Beautiful, where I make the connections between what I see in the skin and how you can look at your skin and say, oh, I'm having this rash around my eyes. I had a patient who came in and she had a horrible rash around her eyes and she'd never had it before. And I said, a lot of times when I see someone with a new rash around their eyes, it could, be a million different things, but sometimes it's because they're things that they don't want to see and they end up rubbing their eyes a lot or things they don't want someone else to see about them. So she came back about a year later and she was in for a skin check and she said, I didn't like what you said last year. She said, that didn't feel very good. She said, but I went home and I thought about it. And she said, I needed to have a conversation with my boyfriend because I knew something was going on and I just didn't want to confront it. And she said, you were right. I was rubbing my eyes. I didn't want to see it. And obviously I gave her treatment for it too, but I just put that out there as like something to bite. Like, is she going to take this or not take it? Some people it resonates. Most people, you'd be surprised, it does resonate and it's different for everyone. And I'm not analyzing anyone. I'm just saying what I see. And it's not just a rash around the eyes. It's the way they make eye contact that tells me, or they don't make eye contact that tells me there's more to this than what I'm seeing myself and what they're telling me. So I don't say everything to everybody, but it's when there's those clues that come to me. And she said, so